Hello, everyone. My name is Hossny Alaws. I'm PGY2 at Northeast Georgia Medical Center, and I'm presenting a case on cobalt toxicity in a patient with metal-on-metal hip replacement. My co-author is Dr. Mahmood. So to start off, basically, cobalt toxicity has been very, well reported. It results from chronic exposure to cobalt. And it can lead to multiple different presentations and can involve multiple different organ systems. And then metal-on-metal hip replacement is also very common. There's millions of these procedures worldwide, but it's very rare to see that metal-on-metal hip replacement causing a cobalt toxicity. So it's a very underreported case, and that's why I wanted to share it. So this is a case of a systemic cobalt toxicity from an old hip arthroplasty. What I want to do here is showcase the mechanism and recognize the neurologic presentation of cobalt toxicity. So this gentleman here is 47 years old. He had a metal-on-metal hip arthroplasty 14 years ago. And he came to his primary care doctor saying that he's having bilateral upper and lower extremity neuropathy that's been ongoing for weeks. He's also having insomnia and night sweats. So his primary care doctor did the basic workup for neuropathy, A1C, vitamin B12, ferritin, thyroid function, even through an HIV test there, and it was all negative. The symptoms persisted, but the cause was not really identified. The primary care doctor prescribed Lyrica for the patient and, just said, you have neuropathy. We don't really know what's causing it. 1 year later, he started having pain from the side of his hip arthroplasty. So he went to an orthopedic surgeon. The orthopedic surgeon did an X-ray, and the X-ray is showcased here. It shows basically a vertical displacement of the acetabular component of the hip arthroplasty. So the orthopedic surgeon kind of connected the dots together and said, this could be toxicity, because he read some reports on cobalt toxicity from hip arthroplasty. So meanwhile, when the patient presented to his orthopedic surgeon, he had some new symptoms. He had diarrhea, headaches, memory problems, anxiety. So the orthopedic surgeon checked a cobalt level, and it was very, very high, 11.5. And so he diagnosed him with cobalt toxicity. He went to the hospital for an elective hip arthroplasty, and that's where I came in contact with the patient. He underwent a revision of his hip arthroplasty, and it was changed to a ceramic acetabulum, and there was some cultures intraoperatively that were negative. But the interesting thing is that all his symptoms resolved after the arthroplasty, confirming the diagnosis. So the conclusion here is that this case is very rare. I mean, I looked at the literature. There's about less than 20 cases reported, but I doubt that it doesn't happen often. I think it's rare because it's under-recognized. The diagnosis is usually just history, physical, and laboratory confirmation with cobalt levels. The management is not really well documented, but just basically remove the source of cobalt toxicity. And as I said, the mechanism here is not really well understood. It could be related to inhibition of the Krebs cycle. Some people report mitochondrial toxicity, and that's why cobalt toxicity can present with neurologic symptoms, cardiomyopathy, hypothyroidism, and muscle weakness. So all of these very metabolic cells can be affected. Basically, we recommend evaluating cobalt toxicity in patients with prior metal-on-metal hip arthroplasty and neurologic symptoms. So that's my case.
This is an amazing case.
Thank you.
Anyone have any questions?
How long before the patient, since having the arthroplasty, did he live in full timeline-wise?
Weeks, yeah. So over weeks, he came to his primary care doctor, weeks later and reported improvement in his symptoms.
What exactly do we think the cause of the cobalt toxicity was? Like, had a piece broken off or?
Yeah, so it usually is from the wear and tear of the cobalt, because the actual metal-on-metal hip replacement has cobalt in it. And so wear and tear can cause release of cobalt into the system. In this case, there was some displacement of the hip arthroplasty, and that's might have led to exposure to cobalt.
So my question is, well, more so a question and statement. My attending always says the eyes can't see what the mind doesn't know.
Mhm.
So I had no idea what this case was until you presented it. How does it change your practice and work with these patients moving forward?
I definitely, I always, the reason I like this case is because I always get, I'm always intimidated by a neuropathy. When a patient comes with neuropathy, it's always, it can be very, very difficult to determine the cause. So history is important. And I think kind of recognizing that the patient had a specific type of hip arthroplasty. So when someone comes in with neuropathy, I will definitely ask about surgical history, a detailed surgical history.
Thank you.